So today is liver function test. So regarding the introductions, there is human liver anatomy. So liver is the second largest organ after the skin in our human body. So the liver is a dual organ. It was involved in the secretory as well as the excretory. So it is involved in the secretions of the various hormones, proteins, many biomolecules. So they are required for the regulations of the daily activities of the body. Even it was synthesized the various cofactors are enzymes and peptides. So those are involved in the blood coagulations or many other defense mechanisms. And also the liver is mainly involved in the excretions of the waste material. Okay, so that is the ammonia that was excreted through a liver only. So that's why the liver will be having the both secretory as well as the excretory function. So regarding the location, the liver is located just upright part of the belly or abdomen. It is just under the diaphragm. Okay, it is just under the diaphragm and as well as it is the top to the stomach. And also it can touches the right kidney and intestine. It is the exact location of the our liver. So the color regarding it is a dark reddish brown. So and average. So weight of the liver is a 1.5 kg. So liver is mainly divided into two loops with the help of the fissures, that is the right loops and as well as the left loops. So liver is also having the good circulations. It can interconnect with the portal vein and as well as the hepatic artery through which the liver can exchange the blood or metabolites. So that of with the our systemic circulations. So liver is also secrete the bile into the gallbladder for store of the biles through a bile duct. So this is regarding the general, there is a liver anatomy. So already detail we have learned in the human anatomy physiology subject in the chapter that is the digestive system. Okay, so liver is here. It is one of the important organs. So whatever the drug you are taken, so maximum drug, so they are metabolized in the liver. So protein metabolism, carbohydrate metabolisms, as well as lipid metabolism and multivitamin metabolism, that is also occurs in the liver. So liver is also involved in the detoxifications of the substance or waste. So that's why so liver is the one of the important organs in our body. So regarding the physiology of liver, so liver play an important role in the metabolism of carbohydrates. Okay, the glucose can be metabolized and as well as the excess of the glucose, so that was stored in the form of the glycogen in the liver only, or liver play an important role in the formations of the glycogen. So when the starvation, when the deficiency of glucose in the blood is taken plus, so on that time the liver, it can enhance the glycogenolysis. So due to glycogenolysis, the glycogen can break down into a glucose. So that's why the liver, it was play an important role in the carbohydrate metabolism, so as well as protein metabolism. So liver, it can metabolize the proteins and releases the many amino acids. And those amino acids, they are required for the synthesis of the another proteins. Okay, so due to that, it is continuously, it can supply the amino acids to our body for synthesis of the desired proteins or new proteins. Also, the beta oxidations that was occurs in the liver. Okay, so that's why the liver is also participates in the metabolism of the fats. Due to that, the ATP was produces. So that ATP is helpful for the synthesis of the proteins or to maintain the energy level in our body. So liver is also involved in the metabolism of vitamins, hormones and many drugs, maximum drug. So they are detoxified or they are metabolized in the liver. So that's why, so whatever the drug you are taken, we are taken, so that drug is mainly metabolized in the liver. And liver is also play an important role in the productions of the bile. So bile is the breakdown of fats. Okay, so then it can secrete the bile into the small intestine. So that is the one. And that bile was helpful for the regulation or metabolism of the lipid in the intestine. So that's why the liver, it is also involved in the productions of bile, and liver is also having the synthesis functions. That is, liver is involved in the synthesis of glucose, synthesis of proteins, synthesis of clotting factors. So those are required for the blood coagulations. Then plasma proteins, so they are required as the carrier. Okay, also they can maintain the density of the blood. Okay, also they are acts as the carrier for the many hormones, many enzymes, and many drugs regarding the albumin and globulins. So albumin globulin are the plasma protein. So they are also synthesized from the liver. So that's why the liver is also play an important role to maintain the gravity or specific gravity of the blood, also by involving the continuously by supplying the plasma proteins. So liver is also involved in the synthesis of the cholesterol or steroids, and also heparin and somatostatin. Somatostatin, it is the anti-growth hormone. So it is also secreted from the liver. So pancreas is also secreted somatostatin, and liver is also secreted the somatostatin, that was considered as the anti-growth hormones. And here the liver is also secreted the heparin. So heparin is the one of the natural anticoagulant that was synthesized in the liver, and it can prevent the blood coagulation. So that was occurs in our body. So daily the blood can be clotted because the blood can move in the blood vessels. So due to movement of the blood vessel, the platelet can struck in the certain part of the blood vessels. So due to struck, so those platelet are activated, they can initiate the blood coagulations. And after the blood coagulation, certain clot still, so that was present in the blood. Okay, but naturally, so in our body, the liver can supply the heparin or give the synthesize the heparin and supply to the blood. So that heparin, it can prevent the coagulations of the blood and prevent the generations of the arteriosclerosis as well as myocardial infarction and atherosclerosis. Okay, it means if the liver is under the problem, means the heparin cannot be synthesized. If the heparin is not synthesized, mean then the blood coagulation is occurs in the blood vessel that was responsible for to cause of the heart attack, hypertension, arteriosclerosis, even the myocardial infarction. So that's why, so whatever the physiology of the body is there, or certain disorder, so they are associated with the liver. And also the liver, it was play an important role in the heat productions. So our body temperature, it is need to maintain the normal level. Okay, so decrease and increase the body temperature, so that was reflects on the organ functions. But still the our thermostat, so that was located in the hypothalamus. So that thermostat, it was involved in the regulations of the body temperatures. Okay, so it can give the signal to the liver when the temperature was decreases. Okay, so that liver, it is initiate the metabolism of fat or metabolism of protein. So due to that, it can produce the more heat. So that heat is utilized for to normalize or to maintain the body temperature. So that's why the liver is also play an important role in the regulations of the body temperature by involving in the heat productions. So liver is also acts as the storehouse functions. So liver is actually participate to for to provide a storehouse for various substances like a glycogen, amino acid, iron, folic acid, vitamin A, vitamin B12 and D. So the excess of these substances are biomolecule, so they are stored in the liver. So that's the liver is acts as the storage for the various biomolecules. And liver is also having a hemopoietic functions. Hemopoietic means somewhere, so that was related to the blood component synthesis. So liver is also actively participate in the synthesis of the blood cells. So here the liver in the intrauterine life, okay, when the baby in under the womb, between 3 to 4 months of the baby, in inside the woman body or mother, so where the bone was not developed very well, and also the RBM is not matured, but still the blood cells, so they are synthesized in the liver because blood cells are synthesized in the body because of the liver or spleen or thymus gland. So these are the various glands, so they are involved in the synthesis or productions of blood cells in the intrauterine life. So dear students, the liver is also produces the clotting factor like factor 5 and as well as factor 7. So these coagulations factors, so they are required, are helpful for the blood coagulations and prevent the hemorrhage. If any problem in the liver, then the blood coagulation do not occurs, then internal hemorrhage is processed. Okay, internal bleeding is occurs because lack of the blood coagulation factor due to malfunctions of the liver. So that internal hemorrhage, if it is occurs in the brain, means the stroke is processed. Due to stroke, the person was die. So that much the life of the person is also depending upon the liver, whatever the factor that was synthesized from the liver. So liver is also involved in the synthesis of the fibrinogen. So that fibrinogen, it was involved in the blood coagulation. So the fibrinogen only it can convert into fibrin in the presence of the prothrombin. So that fibrin, it undergo the structural changes or polymerization reaction in the presence of factor 13 and as well as calcium. Then it can loses the pyrrole ring, then the blood become the semi-solid like substance or jelly like substance. So that was known as the clot. So that formations of semi-solid like substance that can prevent the hemorrhage, so that was mainly depending upon the fibrinogen. And liver, it was involved in the synthesis of the fibrinogen. So that's why the liver, it was participate in the to prevent the bleeding by involved in the blood coagulation, and also it was involved in the healing process. So liver, it is also involved in the or participate or to have the excretory function, the various waste material or especially the heavy metals from the plant sources of food. So they are excreted from the liver. So liver, it was mainly play an important role in the excretions of the heavy metals or toxic substance or various metabolites, especially the volatile oils, oil, ammonia and bile. So that was excreted from the liver. So that's why the liver is also having the excretory functions. So next one, the liver is also involved in the destructions of the RBC. So after the 120 days, so RBC are aged, so they become the fragiles. So due to fragiles or irregular structures of the RBC, so they are unable to occupy the oxygen, or oxygen cannot be enter into the RBC. So that RBC was known as the aged RBC due to irregular structure, because the RBC are the biconchave structure. So due to biconchave, easily the oxygen can enter or exist from the RBC. But as the day age is going on, so RBC become the fragiles. So due to that, the structures become the irregular. So that irregular structures of RBC, so they are failed to occupy the oxygen or deliver the oxygen. So that's why, so what are the ages are there? So the liver is having the Kupffer cells or reticuloendothelial cells. So when the blood is passes through the Kupffer cells or reticuloendothelial cells, so those irregular RBC, so they are ruptured. Okay, so they are destructed. So that's why, so the liver is also play important role in the removal of the aged RBC. So that was helpful for the replace of the new RBC, and as well as due to destructions of RBC, it can produce the hemoglobin. So that hemoglobin can once again separated, it can produce the heme and globin globin will be reutilized and heme is involved in the formations of the bilirubin and as well as the biliverdins. So these are the components of the bile pigments. Okay. Then liver is also involved in the conversion of poisonous ammonia into a urea. So ammonia is the end products of the protein metabolisms or amino acid metabolism. So that was highly toxic. So it can damages the that is the tissues of the brain. But still, so due to presence of the liver, so that toxic ammonia can convert into urea. So that's why our body will be free from the ammonia intoxication if our liver is a healthy. So these are the various physiological functions of our body that was mainly depending upon the conditions of the liver. So next we can go for the regarding the liver function test. So here the liver function test is also known as a LFT. Okay, so LFT means liver function test. Many times the doctor shortcut they can refer in the prescription LFT. So LFT means the doctor they suggest for liver function test. So various tests are there. So they are helpful for the to monitor the liver functions. Okay, so liver function test is also known as the LFT, also referred as the hepatic function test or liver panel test or liver enzyme test. So are for the blood test that measure the several enzymes and proteins in the blood. So that was mainly synthesized from the liver. So due to liver malfunction, so these enzymes or hormones levels are elevated or decreases. So these are the following reasons. So they were the doctor they can prefer the liver function test. That is the routine health checkup to screen the gross liver functioning, then to assess the liver functioning in the presence of risk factors or conditions such as diabetes, fatty liver, high triglyceride, obesity, high blood pressure, anemia. So due to these comorbidity diseases, so doctor they want to know what is the scenario of the liver during these diseases. And also the presence of symptoms of liver disease such as jaundice, dark urine, pale colored stools, upper abdominal pain or swelling. On that time also the doctor they can prefer the liver function test to note down the what is the risk factors for the dark urine or jaundice, pale colored stools or upper abdominal pain or swellings. Okay, next one. It is also preferred for screening for viral infection of the liver such as hepatitis A, hepatitis B, and hepatitis C. So, due to viral infection, whether in a liver is suffering from hepatitis or not, that is also confirmed by preferring the liver function test or LFTs. And also, alcohol consumers to check the conditions of the liver in the alcoholic patient. The doctor they want to know the conditions of the liver because in the alcoholic patient the liver is easily damages. So doctor they want to know the what is scenario of the liver in the alcoholic and also it is help assess the severity of liver dysfunction in the case of fatty liver, hepatitis and liver cirrhosis. And also it is prefer to assess the progressions of liver disease such as hepatitis and cirrhosis. Doctor note down the progressions of the disease. So that is also with the help of the LFT and also it is helpful for to check the effectiveness of treatment. So what treatment the doctor is given for many conditions because so when the patient is admitted the doctor they prefer the liver function test. Okay, they know easily they having the values regarding the say, bilirubin, certain enzymes, proteins like that. So they will be noted down. Then they give the therapy. Then after during the therapy also they can go for the liver function test. If those abnormal elevated level decreases means that indicates the therapy was achieved in the success way. Otherwise the therapy was the fail. So that's why the liver function test is also helpful for to check the effectiveness of the treatment. And also it is helpful for or it is preferred to monitor the possible side effects of medicine or therapy. Okay, so they want to note down the or monitor the side effects of the medicines or therapy that was given to the patients, and also the new therapy, new medication under the study clinical trials, that is also assessed. Their side effects can be monitored. So by monitoring the liver function test. So these are the various reason. For this reason, the doctors, so they are prefer the liver function test. So liver function test is also known as the LFTs. So next one, the standard liver function test. So these are the following tests. So they are commonly used for to perform the LFTs. So on the basis of the liver function, so these tests are mainly classified into 7 classes. Okay, so that is the number one. The test is based on the metabolism, that is the carbohydrate metabolism, any abnormalities of carbohydrate metabolism, so that can assess with the help of the galactose tolerant test and fructose tolerant test. Then lipid metabolism, abnormalities in the lipid metabolism that can assess with the help of the estimations of serum cholesterol or estimations of the fecal fats. And proteins abnormal metabolism, so our liver that was involved or not, that is due to abnormal metabolism of protein. So what is scenario of a liver or liver function that was performed by estimations of the total proteins, albumin, globulin, EGO ratio, determinations of the prothrombin time, because prothrombin time is mainly depending on the fibrinogen, and fibrinogen is synthesized in the liver. If the liver is malfunction, mean the prothrombin is not synthesized, fibrinogen is not synthesized. Automatically, the prothrombin time, the time is required to blood clot, that was increases. So with the help of prothrombin time also, we can assess the functions of the liver. Okay, just by monitoring the sleep time by administrations of the any drugs. Okay, flocculation test like a thymal turbidity test, zinc sulfate test, colloidal gold test, cephalin cholesterol fluctuation test, formal gap test, and aminoacid urine. So they are helpful for to assess the LFTs. And certain tests they are based on the excretory functions of the liver like a bromosulfothioline BSP test and rose bengal test. So these constantly they are excreted from the liver. So monitoring of these, so we can got the LFTs. Then third one, the test is based on the detoxifications or protective functions of the liver, like conversions of ammonia to urea. So that is that can got the LFT through estimations of blood urea, estimations of blood ammonia, then formations of bilirubin or diglucuronate that was assessed by the estimations of serum bilirubin, icteric index, VD, Berg reactions, urinary estimation of bilirubin and urobilinogen. So that was helpful for to note down the abnormalities in the bile pigment metabolisms. It is one of the functions of the liver that was involved in the bile pigment metabolism. So that was assessed by the these test, and Hiprid test is also. Next fourth one, the test is based on the excretory function like a bromosulfonium BSP test and rose, sorry it is the double. Okay, Bengal test. Then test based on the storage functions of liver. There is the glycogen estimation, lipid estimation, estimations of vitamin A, D, B12, estimations of serum iron binding capacity. So that is also helpful for to note down the conditions of the liver are involved in the LFTs. Then test based on the serum enzyme derived from liver, that is the determinations of transaminase, alkaline phosphatase, S nucleotase, and glutamyl transpeptidase. These are the enzymes, so their level was increases during the liver cirrhosis or jaundice or hepatitis or liver toxicities. So the helpful of these estimations of these enzymes, we can got the conditions of the liver. Then cellular structural studies, there is a liver biopsy. Okay, subject liver biopsy or study of the liver tissues. So that has also gives the idea regarding the liver. Okay. So these are the various standard tests applied for the LFT. So in the next class, we can discuss regarding the list of the tests for hepatic dysfunction or bile pigments metabolisms.